and free to access resources for both your own health and wellbeing and that of your teams as well. So do take the time to explore and utilise some of the links that we're providing. Can't emphasise enough really the importance of us all looking after ourselves and each other really in being able to deliver that safe and effective care to others. I think we mentioned last time as well about the integrated care boards and their websites and their teams offering that wealth of resource as well in terms of health and wellbeing resources. So do access their websites as well. They do put on a lot of free Teams and Zoom events as well for people to access. So if we move to the next slide, I'm just going to hand over to Marina because I think she's got a quick announcement to make to you all before we then move on to the officers update.
Thank you, Vicky. So just a very brief announcement before we get started. So as you'll probably all be aware, we've been doing the election for the NQICAN chair as Vicky has reached the end of her first two-year term. The request for expressions of interest, we went out for a request for expressions of interest at the beginning of July, both on the forum and a direct email as well. And we received an expression of interest from Vicky, and then we've held the election this morning with the representatives of the regional networks, and pleased to let you all know that Vicky will be standing as NQICAN chair for another 2 years.
Brilliant, thanks Marina, and it's thank you. I think it's been a good 2 years and it'd be great to keep going for another 2, but obviously we can't achieve what we do achieve without the regional network chairs, our co-opted members, and obviously our members of all the networks, as well as support from HQIP and NHS England and all the national clinical audit providers and everybody else. So we'll see what we can move on to achieve for the next 2 years, I think. But obviously we do need to do a little bit of work on succession planning really, and Marina and I have talked about doing a little bit more promotion on both of our roles as well to try to encourage people to feel that they're in a position to potentially put themselves forward in the future when these posts become vacant. So yeah, watch this space. We'll be out there promoting the roles and how you can get engaged. Lovely, thank you. So we'll move on to the officers update if we could move to the next slide, and just a quick reminder just to keep people onto mute if you don't mind whilst we're talking. If we move to the next slide, I think we've got the chair's key points I think that we'll just cover. So yeah, thank you, that's great. So obviously the slides have been prepared to act as that standalone information source on the network and sharing forum and also our website for anyone that can't join, but also so you can look back at the slide pack, click on live links and go to the resources that we're referring to. So probably quite heavily content on each slide, but it's because they've been made for that purpose. So we're going to update you on what we've been doing since we last met in June, in particular the forward plan, the task and finish groups, our regional networks, letting you know about the 2024 meeting dates as well. And Marina will touch on some of the governance and financial aspects of NQICAN as well before we move to questions. And as we've mentioned, we'll highlight those further resources for you throughout the whole of this morning, and we'll pop some links in the chat as well as those that are available on the slide pack. So if we can move to the next slide, then we'll just have a quick look at the activity then since June 23. It's been busy. We say this every quarterly meeting. I think it is a busy time. We've held regular steering group meetings and HQIP meetings as well, as we always do through quarter. We've continued to meet with the regional network chairs to discuss how the networks need to reshape to align with the integrated care board changes. Worked on the improvement priorities through the officer roles and the co-opted members and the task and finish groups as well, some of which are the webinars being planned with the Health Innovation Networks, previously known as the Academic Health Sciences Network. So that's a recent change in name for anybody that's not picked up on that yet. Those webinars are around innovation and adoption of the medtechs and our collaboration also with the NHS England transformation team in support of the NHS Impact and taking action on national clinical audits as well. And we'll hear about both of those a little bit later on. In terms of on behalf of NQICAN, then we've continued to attend the NHS England Executive Quality Group, Clinical Audit Subgroup, and also the implementation groups as well. NQICAN are invited to provide that local audit voice to those discussions. And I know we've got Victoria Treadway from the transformation team at NHS England joining us later to give us all an update. Back in July, we held the third of a series of the webinars looking at taking action on national clinical audits. And again, we'll hear a little bit more about that as we move through the morning. We've obviously been actively promoting the workspace on the NHS Futures platform, the knowledge and sharing hub, dedicated workspace for talking all things national clinical audit, really. And all of this activity undertaken by the core members obviously drives that forward plan for us and those improvement priorities. If we move to the next slide then, busy again, but it's just quick infographics really on where we're at then with those improvement priorities. Probably that most significant one is the top one, the clinical audit for improvement, where we're working towards this by attending and participating in the EQG CAS group that I've just mentioned, the further support, the subgroup, the further group, the implementation group. NQICAN have had a fantastic opportunity to really work closely with the medical and transformation directorates at NHS England, so that we are actively putting that voice into how we're shaping not just national clinical audit but local clinical audit back in our organisations as well, and that will continue. We obviously saw the launch of the NHS Impact over the summer. And I suppose that's now pushing us all to make sure that our effectiveness work streams and our teams feature quite strongly within how each of our own organisations will take this forward. Obviously, the whole core 20+5 and addressing the health inequalities agenda as well. Our support of the NACAPOP topics, obviously the highest mandated suite of those national clinical audits that we participate in. And then obviously the knowledge and sharing hub that we just mentioned on the NHS Futures web space. And then we've also got, we're a seat at the table with a recently funded project through HCRIP and the Q community, really looking at taking system-wide improvements forward on the back of a national clinical audit, really in its early planning stages at the moment, but obviously we'll get involved there as well. Clinical Audit Awareness Week is always one of our priorities on our forward plan. We had another successful week this year, and we'll touch on that a little bit later as well. 1 week in time, but obviously we encourage everybody to continue every day through year. And then this week itself is that taking that time to reflect on what we are achieving, where we're going next, and really promoting that continuous improvement approach. Embedding that wider innovation then within clinical audit for improvement. The series of webinars that we're currently working with Dorset Innovation Hub and the Health Innovation Networks around adopting medtechs and measuring through clinical audits. So we'll touch on that shortly. And the measuring success of our local programmes, where we're trying to engage with our community to learn where we've already got resources that help us to measure that impact, but also to identify where we've got gaps and to get people on board to help us to develop some effective measures. So you can see at the bottom here our continuous improvements around developing the networks, the chairs, the succession planning, holding more local webinars around local programmes, and obviously the infographics user network, reviewing the education and training directory, and obviously continuing to develop the forum that we've got as well. We're at that time of year where we do review our progress against the improvement priorities, obviously, so please do put ideas forward through your regional network chairs, via the forum, or obviously sending us emails directly to the nqi.can1@nhs.net inbox. So I'll quickly move on to the next slide then, and it was really just to highlight again to you NHS Impact for those that haven't read the NHS Delivery and Continuous Improvement Review or the NHS Impact information since it launched in the summer. NHS Impact have now got a workspace on NHS Futures platform as well. Worth getting yourself registered and joining there so that you can be networking with people as well. We obviously had the second of a series of 3 webinars held in Clinical Audit Awareness Week, where Vin Dawakar, the Medical Director for Secondary Care and Transformation, was very much talking about the launch of NHS Impact, how we can take action on national clinical audits. And in the Friday's Lunch and Learn for Sustainability, John Ashcroft, Director of Pathways at NHS England, also spoke to us about how we can now make sure that our teams and our work streams are working within our own organisations to really support this NHS Impacts, this one improvement approach for us all to be following. There was also a webinar last week from the Health Foundation where they talked about actually trying to then get this into practice. So if you visit the Health Foundation website, just Google the NHS Impacts, they've actually already uploaded the recording of the webinar and the slides as well from the session. Definitely worth going and having listened to it. They'd got a couple of people on there that were already taking it forward within their organisation, so it was a really valuable resource to access. So if we move to the next slide, then again, it was just to really plug the NHS Futures Workspace for the Knowledge and Sharing Hub. I know Victoria is going to touch on it, so I'm not going to say too much here for you, but we did start some threads last week on trying to engage the audit community to maybe work with us around picking 1 or 2 standards for a national clinical audit where we know across the country our compliance is low, and we can perhaps... Can I just ask you to put yourself on mute, please? Thank you. Where we could perhaps work together as a clinical audit community on local quips in our own organisations to try to improve our compliance against those standards, and we'll see the impact of that coming through on later data sets with the National Clinical Audit. It might be that you've got a topic that you would rather drive some change in. We've looked at the asthma one in a thread we started on Friday, but please do join us in trying to get us all to work together to improve really and take action on National Clinical Audit. So if we move to the next slide, I'm going to touch on co-opted members. So our co-opted members for NQICAN have been leading on some of our improvement priorities. We've got Carl Walker, Sarah Chesil and Kerry Feltboer, who are our current co-opted members. Before I touch on some of the work streams that the 3 of them have been leading on, I just wanted to move on to the next slide really to give thanks to Carl, because we wanted to say a big thank you to you, Carl, because obviously your time as co-opted member now is coming to a close. You've been a co-opted member now for 2 years. So Carl was first involved in our work through the National Audit and Governance Group, NAG, back in 2011, then as the East Midlands Network Chair, and later becoming the Chair of NQICAN for 6 years. And then obviously the last 2 years has seen Carl continue to contribute to the forward plan as that co-opted member, covering the initiatives here that you can see on the slide. So your contribution, Carl, has been absolutely immense, and it continues to. So we just wanted to take this opportunity to say thank you in the open meeting, because we've got a lot of regional network members that have joined us today that have obviously seen you in the many roles as we've gone through the years, and obviously we're going to continue to work with you. You're obviously continuing as a network member within the regional network. We can see you actively on the forum and obviously on the NHS Futures web space, and helping us take that clinical audit for improvement priority forward as well over the next few years. So it was just, yeah, opportunity to say thank you. So if we move on to the next slide then, so Sarah Chesil, head of the Dorset Innovation Hub, is with previous General Secretary, has continued as a co-opted member to help lead the embedding a bit more around innovation and clinical audit into NQICAN's work streams. So currently we're running a series of 3 webinars with the Health Innovation Network, the first of which was delivered on 5th of October via Teams. It was recorded, the recording's on the YouTube channel, and the slide pack is on the forum. And we're currently looking at workshop 2 and 3 to run from the spring, and then the 3rd one in the summer and autumn of 2024. I think you can see here from the Wordle on the screen that the biggest takeaway from workshop 1 was the collaboration, which is really positive, and the attendees gave us a number of great pledges that they're now going to go away and work on before we then host workshop 2. So if you're not yet aware of those, go and visit the NQICAN forum, access the recording slide pack, and yeah, join us in trying to support more wider adoption and spread of the use of the medtechs, and then measuring the impact through clinical audit. If we move to the next slide, Kerry then's leading our Measuring Success of Local Programmes Task and Finish group. We held a webinar around this back in 2001, and obviously there's a lot of good work out there from our network members of measures that you've already got existing in your organisations. So Kerry's busy at the moment collating what she can that's already in existence, and she's looking now for some volunteers to support her in taking some of that work forward and developing developing further measures and holding potentially another webinar. So please do get in contact with Kerry directly. We'll pop her email into the chat, but also head over to the forum where we've got some threads around this improvement priority, and we can all get involved. So if we move on to look at the regional network slides then. This is the map of the, sorry, just back one slide, lovely, thank you. This is the map of the regional networks that we've got around the country. If you're not yet a member, please do get in touch with us. We'll put you in contact with your network chairs. Marina and I have been visiting some of the networks around the country that are currently looking either for a chair, a deputy chair, or getting to establish steering groups to support the people that are leading those networks. So please do consider those roles as those expressions of interest are coming up, because it's a fantastic opportunity to get involved, to help lead your regional network, and then to get involved at a national level through the core members at NQICAN as well. So visit the NQICAN website, drop us an email, or talk to us on the forum as well. I know that the regional network chairs are busy at the moment, busy in their planning their next meetings that will follow on from this open meeting. So if we just head to the next slide, it was just an opportunity to touch on today that we've previously explained that the open meetings here are about getting key speakers to come and talk to us all about disseminating information out to us all and engage us in initiatives, and then obviously provide the opportunity to ask questions directly. And then as we move into our regional networks, we're going to take those meaningful discussions forward with our local providers and commissioners, so that we can look to see what that means for us across our systems and across our patient pathways, and how we can make those improvements and make things even better if. So do look out for the next dates of your regional network meetings coming, being announced. There's information about the regional networks on the NQICAN website, but if you head over to the forum, each regional network's got a page where they should be uploading their meeting dates, their agendas, and their slide packs for you all to get involved. And then if we move to the next slide, we always share our pledges to you and the community. Behind the forward plan and those improvement priorities, there's a lot of work that goes into supporting and shaping the central NQICAN and regional networks. It's not always visible, but obviously if you're not yet a member of your network, we strongly encourage you to get involved, and obviously to make your pledges as well, so that we're effectively utilising clinical audit to improve patient care. So I'm going to hand over to Marina now, if we move to the next slide, who's going to give you a quick update on what she's been working on. Lovely, thank you. Over to you, Marina.
Yeah, so just in terms of the chair election, obviously I've already highlighted that this morning, and yeah, very pleased that Vicky will continue with us for another 2 years as NQICAN chair. And grab the next slide, please, Sonia. Okay, and then in terms of my general update in terms of the activity that I've been supporting, obviously alongside Vicky for a lot of the things she's already mentioned, so there will be some duplication here. So in terms of our reimbursements, for those who are not aware, we do have the ability to claim some reimbursements of time through HQIP from NHS England. And so far to date in 23-24, we've had reimbursements of 4,738 that have been claimed. As Vicky's mentioned, this is sort of a general update in terms of sort of progress and activities we've been working on since June. So we have been very active supporting the regional networks that are currently without a chair, and definitely reiterate what Vicky said in terms of, you know, do consider putting yourselves forward for these opportunities to chair your local regional network, even if it's on a trial basis. It really is such a valuable experience. You know, sort of being able to engage with your local colleagues and kind of having that you know, that role really in your region. As Vicky's mentioned, we've been working on the 2-year report for NQICAN, and you should expect to see that coming out in the next few weeks, and we've put the final touches on that. Obviously, the lunch and learn sessions as part of Clinical Audit Awareness Week have been a significant portion of activity over the summer in terms of how we've been spending our time. We've got the Q1 declarations of interest that were done for April to June, and then the request for Q2 has also just gone out now as well for July to September. I've also been working on updating the training directory. As Vicky's mentioned, as part of one of our improvement priorities, that was one of our roles, or one of our aims was to update the training directory. So I've made a start on that, but obviously had to kind of put the work on pause while there were other priorities taken over, such as the audit awareness week. But if anybody knows of any training, that you'd suggest that you're aware of, that you want included on the training directory, please do head on over to the forum. You'll see I've got a post on there in the NQICAN section if you want to add any training that you'd recommend into that, and then we can make sure it's in the directory. Next slide, please, Sonia. Yeah, that's it. Back over to you then, Vicky.
Oh, lovely. Thanks, Marina. Yeah, just letting you know that the 2024 dates have been set for next year, and Teams links are already up on the website and also on the forum, and they're open access MS Teams links, and obviously you can share them with your teams and your network members as well, so they're already there for you to access. Put these dates in your diary, save the dates in, so that nothing else gets booked in, and we look forward to you joining us. So if we move to the next slide, I think we've literally got a few minutes just to touch on the before we hand over to HQIC, really just to touch on the evaluation of our lunch and learns. I think Marina did a fantastic job of putting the evaluations together and managing those, and obviously we've looked at the outputs so far. So if we move just on to the next slide, you can see we held 5 sessions. We've put you the live link here into the slide pack as well that links up to the recordings, but obviously on the forum you've got the full slide pack that's available for you to go back and look at, because I know our key speakers put some live links obviously to resources in there for us all. So just moving on to the next slide, then you'll be able to see, so this was an interactive evaluation within the session this year. We had low evaluations completed in 2022, but you can see here that that's massively increased. You can see that we had 224 completed through the week from 593 attendees, so a far greater response. So thank you to those that took the time to complete those. So if we move on to the next slide, the ranking was 1 to 5, wasn't it, Marina, for attendees to rank some of our questions?
Yes,
and what we
right.
asked first was, would you recommend the lunch and learn sessions? And you can see here by each day's topics, and you can see here that each day scored above 4 out of 5, so that was a really good response, really. So if we move to the next slide, then we looked at how engaging the key speakers talk was, really, and did it have the right level of information? Did you learn something that you can use in your network? You can see here just slightly taking the edge of the health inequalities and sustainability standing out, but actually they were all really good. So that was really positive that people felt that they were beneficial. So if we move to the next slide, we looked at the Clinical Audit Hero Award winners, and again, health inequalities and sustainability ahead, but also that influence and change, which was really good. But again, across all the days, sorry, if we just go back to the lovely back to the previous one, across all the days, you can see that they were all really good, and it was fantastic listening to our Audit Hero Award winners. And it's just worth reminding everybody that obviously they're the presentations and the examples, etc., are both on the forum. They're on the HQIP website, and I know that they'll be working towards publishing those as case studies. So sorry, next slide then, key takeaways. So the next 5 slides are really key takeaways from each day for each topic. This one here is patient safety. And I think the key messages really was go and check out who your patient safety specialists are locally, get involved in your PSIF, your patient safety incident response framework within your own organisations, and obviously access the slide pack to get those key links from Hester Wayne, who gave us that fantastic talk on that day. On the next slide, we've got patient and public involvement. Utilising the opportunities to engage, really. So making the most of every opportunity you've got locally to getting the patients and public engaged in our improvement work streams, really. Aligning your policies and also using existing networks. But basically, I think the key message is let's all get talking together, I think. So health inequalities then on the next slide then. This was all about really thinking about health inequalities in our local audit programmes as well, because we're seeing it come into the national clinical audit programmes really well, showcasing where we are doing this well and really looking to embed this as business as usual, changing the way that people are thinking now so that we're always considering that health inequalities. Next slide around influencing change then. Biggest key message I think here is about getting senior leadership engagement, the whole suite of making data count resources that we've got there on the NHS Futures platform, and making sure that we're getting the right people at the right level involved in reviewing the outcomes. And then finally, then sustainability then, and making sure that we're embedding clinical audit in as business as usual. We're reducing that data burden, we're releasing resource to focus on improvements, and we're thinking longer term sustainable processes, technologies, systems working. And then I think the last slide is sharing some of our wonderful images on social media from the week, which was so good. It was so good to see all those, the local information, the local photos that we share, and the local events that you were holding. And I know we've asked from feedback from within regional networks so that we're including some of that impact locally within the biennial report that will be publishing shortly that Marina mentioned for NQICAN. And we will obviously start our discussion soon with HCRIP to see what Clinical Audit Awareness Week next year might be looking like. So watch this space. So I think the next slide might be questions before we hand over to HCRIP. So has anybody got any questions for Marina or I? We've obviously got Q&A obviously at the end. So if you do think about questions, post them in the chat, or we've got the opportunity to ask some more later on. If not, I think we'll hand over to Caroline, Kim and Helen then, who's going to start the HCRIP update.
That's great. Thank you very much, Vicky. Thank you. I hope everybody can hear me okay. Just to say good morning to everyone.
A bit quiet, Helen.
Oh, am I? I'll move closer to my mic. Unfortunately, that means my face is closer to the camera, but hey, can you hear me okay now?
Yeah, that's better. Thank you.
Okay. Yeah, my name is Helen Barron, and I'm a project manager at the Healthcare Quality Improvement Partnership. And I'm going to begin our update this morning. So with me are Caroline, and Caroline is one of our associate directors, Kim, our head of patient and carer engagement, and we also have Susan Gillespie joining us today. And Susan is our audit data improvement project manager, and she'll be giving us an update on the NCAB platform. So next slide, please. Thank you. So just by way of an introduction to who we are, HQIP is an independent organisation, and we work in partnership with patients and healthcare professionals. We aim to influence and improve healthcare practice at all levels. Next slide, please. So I'm going to start with a brief update on the Quality Accounts List, the directory, and on NCAPOP subscription activity. So first of all, the NHS England Quality Accounts List. This is really just to note that the process to develop the list for 24-25 is now well underway. The scoping survey of audit providers closed at the end of September. The list will hopefully, the list will be made available in advance of the 24-25 financial year, and hopefully that will be published on the HQIP website around mid-January. That's what we're aiming for. Further information, as always, can be found on the HQIP Quality Accounts webpage. Can I have the next slide, please? Thank you. So moving on to the directory, just by way of a brief introduction or a brief reminder, the directory is designed to be a tool and a resource. It's for guidance and for information only. The data is provided by project providers at a fixed point in time. So manual updates are needed to make changes. And so it might be that the directory isn't necessarily up to date at any given point. It's really designed, I suppose, to be a bit of a starting point to further investigation into specific questions and to look for more detailed information. Just to note that the directory includes NCAPOP projects, so projects commissioned by HQIP. There are also projects listed on the directory that are part of the Quality Accounts List. But there are also other national quality improvement projects operated by other organisations included in the directory. Next slide, please. Thank you. It's worth noting that we've added a new field into the directory recently as part of the last version. And this new field includes links to dynamic reporting and dashboards, currently for NQICAN projects only. So the new field is in column F currently, but of course that could change in future versions. And I've just shown a bit of a screenshot there of the new field within the Excel spreadsheet. So yeah, and finally, I guess on the directory, just to note that we'll continue to update it on a monthly basis as needed. New versions, as always, are posted on the HQIP webpage and signposted on the NQICAN forum. So my final slide this morning, please. That's the next one. Thank you. Yeah, just finally, a really quick update on the NQPOP 23-24 subscriptions. We now have payment from over 80% of trusts, which is great. And I suppose just worthwhile mentioning that if as NQICAN members you can help in any way and follow up with any relevant finance teams, then that would of course be appreciated. Thank you. And thank you for your time. I'll pass you on now to Caroline, I think is following me. Thank you very much.
Yes, it's me. Thank you. So a little bit of a summary of the work we've been doing recently. So you can see there's some tendering activity. So brand new piece of work, the National Eating Disorders Audit. The tender is open and live, as you can see in there, and open as part of an open procurement process. And then recent tender activity has been the mental health clinical outcome review program is being recommissioned, and the closing date for the open procurement process was last month. And thank you. You're ahead of me. Next slide, please. So recent reports, there've been loads. I won't list them all. There's the link there to all our reports. People probably know this, but just to confirm that all our reports are usually, very few exceptions, but usually published on the second Thursday of every month. So that's the date to look for our reports. And if you do click on that list, you can see there's been 3 national diabetes audits that were published in this month's in October's batch of reports, 1 from the National Neonatal Audit Programme, and 3 from the Embrace Mothers and Babies programme, and 1 from the National Early Inflammatory Arthritis Audit, their annual report. So several reports each month, and you can click there, and each month you'll see the new reports come up. Next slide, please. Thank you. We just wanted to mention, yes, the National Joint Registry is 20 years old, and they've launched a 20th anniversary report. It started, now let me get this right. It started with hip and knee data 20 years ago in 2003 in England and Wales, and now it's ankle, elbow and shoulder as well, and also includes Northern Ireland, the Isle of Man and Guernsey. And it's got over 3.7 million records, and it's the largest orthopaedic registry in the world, and the 20th anniversary annual report is available now. I'm going to go. Yes, I will hand over to Kim. Thank you. And then I'm going to come back at the end. And obviously there's a chance for questions at the end of all of that. So over to you, Kim.
Thanks, Caroline. Hi, everyone. I'm going to give the comms and patient and care engagement update. So from the communications team, they just wanted to give a big thanks to everyone who took part in Clinical Audit Awareness Week. We think it was a great event, and we appreciate everyone's participation, in particular to Vicky and Marina for their in-depth involvement and their daily lunch and learn events. And I know that lots of regional network chairs and members were also involved, so thanks for being part of the presentations and the judging, the audit heroes as well. So details of those audit hero winners and the recording from all the lunch and learn events are available on our website, and we've also got a recording of the QI masterclass that happened that week too. A second update about Cornerstone. So this new edition will be coming out in November, and it will be our 2024 edition. It'll be online from November 2023 and has articles from Vicky. And also, if we go on to the next slide, please, Sonia. There is an article from the winners of our PPI awards. So we have Epilepsy 12 and the side-by-side winners who have been interviewed by me in the Cornerstone magazine. So please do access it and read that. Other projects that I'm working on, we've got the National Obesity Audit. We have a user panel of over 20 diverse members from across England, and they are co-producing guidance to use the dashboard on bariatric surgeries. New dashboard with data from community services, and that's launching at the end of the year, and the user panel have been able to input into the metrics that are being used for that audit. We're also working on a project for NHS England that's looking at what matters to what matters most to maternity service users. So we've been engaging with stakeholders to understand which communities are sort of less heard from in surveys and publications and things that are out there right now. And we're working with charity partners to run some focus groups over November. So we've got the Service User Network at HQIP, and they're involved in all of these projects. And they're also going to be involved in a task and finish group to put together a webinar for NQPOP providers about patient and carer engagement within the NQPOP. And this is going to be an alternative to the Richard Driscoll Memorial Award, which we won't be running this year. So just the usual updates. We have opened the way we have membership in the Service User Network. So I really encourage you all to share the link and encourage your patient and public community to sign up to hear about involvement opportunities at HQIP and also external ones as well. And we have resources that are available on our website about involving patients. Please do access them. And if you have any examples, please do share them with me, and I'll talk to you about potential case studies. So final slide, back to Caroline.
Oh, thank you. Yes, we wanted to present some of our recent work. No, I don't expect you to be able to read this, but I've just given you a glimpse of what they look like, and I will put links in the chat. So first up, there we go, the links in the chat there. The CVD, Cardiovascular Disease Prevent, the CVD project that we run with a number of other partners, has got some new tools on the website there. You can now, there's a new section on regional and ICS insights, it's called. So you can choose your region, you can choose ICS, you can choose what you want to look at, and you can see the data in front of you. And on top of that, there is also some age standardized data for some prevalence indicators, and you can make some comparisons across areas with the different age profiles that they have. And also the most recent quarterly data update is now on that website with data up to March 2023. So you will see more, and the quarterly data will be released ongoing on the CVD website, and that's primary care data, so a little bit different than some of our audits. But I would encourage you to explore that. Also, I wanted to show you the new NQICAN website if you haven't seen it. NQICAN, the National Cancer Audit Collaborating Centre. So that's going to be all the national cancer audits in the programme, all hosted now by the Royal College of Surgeons. I'll put the link in the chat in a second. And there are some new FAQs on that website, and I'd really encourage people to look at them because I think it will impact everybody. The way that data is collected for the existing cancer audits is changing, moving to already established data flows rather than bespoke audit systems to capture that data. And the 6 new audits obviously are being set up at the moment and will be capturing data from the routinely collected data imminently starting this year. So the FAQs are on there, and you should be able to find out more information about what that looks like from that website. And there are a couple of new impact reports that HQIP has published. So information about the impact that our various projects and the work that you do has had. There's an in focus insight report for a couple of topics that have really looked in detail a number of areas, and then there's an impact report that covers impact across the programme at local, national, system level, public level. And those are on the HQIP's website, and I can put the links in the chat in a second. And I think that means we're on to questions. So
we have had one question in the chat. Yeah, we have had one in the chat. Are there any plans for a national conference in 2024, or are you planning to work in collaboration with any other organisations for a national CA conference?
That's possibly one for NQICAN, is it? If it means a local.
I think it's been put forward for both. I think it's put forward HQIP and NQICAN. I mean, we haven't planned anything as yet, so I suppose it's just going out to members to find out actually if that's what members are saying they would like, what does that look like, and how might we go about putting something like that on. I know it potentially would have to be virtually rather than face to face, unless we can find free venues, etc. Because obviously I think in terms of NHS England and us claiming for reimbursements of the money for time, we haven't really got monies there to be paying for venues and things. So it would just be knowing that obviously if we did put something on, it's potentially in that virtual domain. But yeah, there's nothing stopping us all having that conversation to find out what it is that our members are looking for and seeing what we could arrange to meet that need.
And then we've got a second question in the chat. Has NCA benchmarking been integrated into the NCA reporting now and NCAB decommissioned?
Well, so our next, I think it's right up after us, Susan is giving a whole presentation on NCAB. So if I may, I'll leave that to her to talk about NCAB, and then we can ask any questions about NCAB after that.
Lovely. That sounds like a plan, doesn't it? So are we seeing any more hands, Marina? I'm not seeing any more. Are you?
If anyone thinks of anything else, I will, I can come back in the chat or come back at the end.
Thank you so much. That was a really good and, as always, useful update. That's fantastic. Really pleased to hear about NatCan moving to using existing data sets, which will reduce that data burden for us all, I think, and release that resource to really pick it up and make improvements.
It fits into the I don't know if new is the right word, but the way that we're working towards across all the audits, if and where possible, is that using those routine data flows that are already in existence and moving towards the more regular, more timely quarterly reporting. And so all the cancer audits are moving towards that model. Some have started that already. Everything I've been talking about is in more detail in our written update, which I think gets circulated after this meeting. So as well as the slides with the headline items, we've done a written update with some more detail, so in a PDF form. So please do have a little look at that.
Brilliant, thank you. That's excellent. Okay, I think we'll move on to Susan then, who's joining us to talk about the NCAB. So over to yourself, Susan.
Thank you very much, and thanks for inviting me to talk about NCAB today. As Helen mentioned, I'm the Audit Data for Improvement Project Manager with HQIP. I've been on board for about 18 months, and NCAB is under my remit. I could have the next slide, please. My plan today is just to give a brief overview of the history of NCAB, what we're working on now, and what we are thinking about for the future, and happy to take any questions at the end. In the beginning, NCAB came from a collaboration between CQC and HQIP, which was essentially aimed at making it easier to engage with audit data. This was for the CQC inspectors, but also for that wider quality improvement community. And it was first launched in 2017 and went through an update in 2020. NCAB still sits as a one-of-a-kind resource because it is open access and it consolidates all the results across the NCAPOT program. Not all of them, sorry, but a subset of those. And it presents the data visually and includes trends over time and national benchmarks where they are available. If I can have the next slide, please. So this is an overview of the steps that are currently involved in getting the audit data onto NCAB and some of the other platforms where we share the audit data. Starting out with the audit providers who agree the key metrics. Historically for NCAB, this has been around 5 to 7. So in some cases, a subset of the full metrics for the audit. The providers then collect the data from the healthcare providers and do all this sort of analysis that's required for the audit reporting. Once that data is finalised and made publicly available, the CQC have been leading on engagement, requesting the audit data and adjusting formats and doing QA checks as necessary once that data has come in. CQC then share that data through their own internal processes to inspectors, but also on to us at HQIP for NCAB and to the Model Health System team at NHS England, where any additional formatting and QA checks are done to get that data ready for those specific platforms. As you can see there, because there are multiple steps involved and QA checking in all the different steps, there can be time lags at each of these stages of the process. And I'm going to talk a bit later about what we're doing to sort of try and address those. If we can pop on to the next slide, please. So just operationally speaking, a quick overview. NCAB is supported by HQIP, but is not part of the NHS England contract. We got some external funding in 2020 to support the update and increasing functionality. NCAB, as we understand, is valued as a resource by NHS England and across the wider NHS because it serves a purpose that isn't currently available on the Model Health System, in that it is a digital resource, displaying provider level data for that clinical effectiveness data. You can pop on to the next slide, please. In terms of the platform itself, we currently have data for 25 audits, but this is made up of more than 65 individual data sets because we have up to 4 or 5 years now of trend data across some of the audits. The one currently on the screen now is an example of the detail view. So this is a metric card, which includes the result for one metric for one audit for a particular trust. This shows the benchmarking results alongside national aggregates and any other relevant national standards. In this case, you can see that the benchmark is against a 5-point scale, but there are other formats for those. Some have a simple sort of met or unmet benchmarking approach, and others have a 3-part scale. So there are different ways that that data is presented. If we can have a look at the next slide, please. This is the summary view where you can see all the metrics from a particular audit for a healthcare provider. These can be, from this page, can be exported in CSV format, which can be used in Excel or any other compatible software, of course. And the metric card you saw in the previous slide can be downloaded as a PDF, so that can be dropped into other reports as required. We pop on to the next one, please. So this is just a look at the site usage. We continue to monitor monthly, and this includes website sessions, so visits on that top chart, and on the bottom chart is downloads, which is a combination of those PDF and CSV files. We put this in here mainly to show that the website is being used steadily over time and that the visitor sessions are sort of slowly increasing on average. If we can move on now to the next slide. To talk about the sort of future of NCAB and what we have been thinking about. We hosted a future forum for NCAB in November of 2022. We brought together experts from the AnchorPop teams, from their IT providers, CQC, Model Health, and some colleagues from the Trust QI teams. The overall aim for the forum was to look at options for modernising and streamlining the data processing that we went through on the earlier slide. And from the NCAB perspective, we were looking to ensure we can keep NCAB as up to date as possible and try and get the data on there in a more timely way. Coming out of the forum, we did identify a few areas that we are working on. The two main ones that we're looking at, first off, is putting together a shared data template so that that can be used to publish across NCAB and the other platforms, so Model Health included and CQC, and ensuring the use of coding for the healthcare providers is consistent. So that's some things that we are working on at the moment. If we can go on to the next slide, please. Things that we need to consider as we're thinking about the future of NCAB is the resourcing limitations. So we are currently set up to do one update per audit per year. Obviously, we're making changes with the NQICAN audits to increase to quarterly reporting, so that's something that we will need to consider. Also with NCAB currently, there's a limited capacity for comparisons and aggregations, and as ICS level reporting becomes more important, that's something that isn't currently supported. Again, as I mentioned, NHS England see model health systems as the sort of future for hosting all the clinical effectiveness data, and they are working on a potential public section of the site, which would then make it available for all users. So we are working closely with Model Health to make sure that we're in line with their capacity and what they're working on. And just to note also, with the current processing system that we spoke about earlier, we are affected by any other changes within other organisations. And I think most obviously this is CQC at this point in time, as they're sort of that key point in the data preparation before it goes on to the platforms. On the next slide, please. So looking at the next step, we are always considering NCAB's role in relation to the sort of wider ecosystem of reporting of clinical audits data. For now, we plan to continue updating annually the data sets as they become available, supporting NHS with increasing their national audit content on Model Health System, and working on streamlining that those data processing systems in the way that we have discussed. So that's a whistle-stop tour of NCAB. I'm happy to take any questions.
Thank you, Susan. That was really useful. Has anybody got any questions on NCAB at all? Especially whilst we've got Susan here with us. Carl?
Yeah, no, thank you, Susan. That was useful to get an update on, because it really is quite fundamental to driving improvement in local trusts, because people like to know how they're doing in benchmarking terms and knowing where you're an outlier, because particularly as the CQC pay a lot of attention to that. So I'm a little bit disappointed that it's not part of national clinical audit reporting as standard now. The last contract obviously wasn't added to that because of the added costs, as you explained. So, but box plots and run charts are pretty standard in terms of calculating as analysts. So, so I'm not too sure whether we're making an industry out of this. You know, if I, as a statistician myself, it's quite standard stuff to do run charts and box plots to see how you're doing. So I would just encourage that to be standard practice as part of the individual national clinical audits when you commission them, to actually ask for that type of information so that we can track improvement over time. And again, conjecturally know whether we're an outlier or not. So that's my only comment, really.
Sure. So the outline reporting is continuing as per previously with the audits, and we're working on an update to our guidance at the moment. And also, I should have mentioned that we're updating NCAB annually, but we are also making changes to the site with each update that we're doing to flag external sources. So as we're asking the audit providers to put together more dashboards and do this quarterly reporting, we're making sure where possible we're providing links to those in obvious places on the NCAB website, so that if there is more detailed data available or more up-to-date data, you can see that from NCAB and go and find those from other sources.
Yeah, I mean, it's just a delay. It takes a long while to get the report, and then there's a further delay to get them in NCOB. So that's why I wanted it ideally to be part of the whole one process, so that we get one report with the benchmarking alongside the annual report. But obviously it's outside your control potentially, but it's just feeding it back from a hospital audit manager. That would be the best way of making this effective piece of work, because it takes so long, it's out of date and it's not useful anymore.
Absolutely, and that's a real focus from what we were talking about at the Future Forum, and these the use of this, hopefully in the future, this data template. obviously cannot make any promises, but in an ideal world, we would hope that where the audits would be using a standardized template so that we know as soon as the audit data is ready for public release, then we will have that data in that format and we can start to get that updated almost sort of immediately after the data is available in terms of the audit report. But we have some work to do before in developing the template and getting that up and running, but that's what we are sort of hoping will be possible in the future.
Thank you.
Lovely, thank you. And I think that then answers, we've got another query in the chat around the production of the NCAB graphs updated after production of the annual reports, but I think that's obviously all of what you've just been discussing, Susan and Carl, so that's great, thank you. This isn't necessarily related to NCAB, I'm thinking, but I know recently in a few of the regional network meetings that I've been attending, there's been a little bit of questioning around how, as provider organisations, we get alerted when we're an outlier. And I don't know whether this is HQIP question or not, but I just wondered, could we just confirm how we are notified? Because I think some organisations have just been reporting that they've not been informed, or it's not come through the chief exec medical director route. And I just wondered if we could just pose that question whilst we're talking about the National Clinical Audit Programme. I'm not sure who's best to answer that one in terms of the outlier process.
So we have the outlier guidance up on the website, and as I said, we are working on a review for that. I can pop a link into the chat for the current guidance, but yes, there should be, especially at the alarm level, those notifications should be going in via the audit providers. If there's specific examples of that notification not happening, please feel free to let me know and I can follow those up.
Yeah, that'd be great. And then I suppose it's probably worth mentioning, Susan, as well, which is the discussion we held at the time within the regional networks, that it's also probably worth the providers checking that they've got the right contact details, maybe with the National Clinical Audit providers as well, because obviously we see medical directors change, don't we, through organisations. So it's probably worth people just double checking every now and then that the National Clinical Audit provider's got the most up-to-date information. But yeah, by all means, Susan, yeah, we'll get in touch. So yeah, thank you.
Thank you.
Lovely. I think not seeing any more hands up. I don't think, are you, Marina, seeing anything? I think
No, I think that's all the questions that were raised.
Brilliant. So I think we'll move on. We've got Yvonne and Rachel that are joining us to talk to us about information governance. So we'll hand over to you, Yvonne, if that's okay.
Lovely, thanks very much. Good morning, everybody. I'm Yvonne Sylove. I'm Associate Director at HQIP, and one of the aspects of my role is to support information governance. With NHS England as funder of the NCPOP for England, we are joint data controller with them, and that means a joint responsibility to understand and navigate that information governance landscape. And as I'm sure everyone on the call will agree, it's complex and it can raise anxieties because one's always wanting to stay within the rules. We have a really close working relationship with NHS England on this and problem solve together. And I'm here today with Rachel Merritt, who's Head of IG Policy Engagement at NHS England, and we've worked together in the past because I think we both feel passionately that we want people to feel clear and comfortable, and we don't want information governance to be a barrier to really important work. So Rachel contacted me because she's interested in thinking about some updates, and I said, please, let's talk to NQICAN because they'll tell you what life is like trying to interpret about national audit, local audit in frontline teams. So I'm going to hand over to Rachel, and thank you very much for having us.
Hi, thank you. Yeah, just to echo that, it's really great to come along today and hear your views. And I know it's a Monday, but we are going to be asking you to do a bit of work today so we can gather those. So I'm just going to give a quick overview of my team so you can kind of place this in context. I'll just share my screen with you. Can you see my screen okay? Yeah. Okay, so yes, my team aims to transform and simplify information governance. So as Yvonne said, we really want to make it accessible to everyone and so that you can understand the rules around IG without having to kind of wade through loads of technical guidance. And my team has a remit to provide national IG guidance and advice to the system. And we have what we call our IG portal. And it aims to provide a one-stop shop for simplified information, governance and advice. And pretty much every bit of guidance we do, we tailor it to different audiences. So we have a section for the public, we have a section for frontline staff, which is kind of practical information. And then at the bottom, we have the more detailed guidance for IG professionals. So if you're frontline staff, you should be able to access that practical guidance really quickly. And we make sure that it's tested so that it's clear for you. The advantage of having the section for the public is that that we can make sure that we're transparent, and I feel really passionately about this, that we should be clear with patients and the public about how we're using their information. So all our guidance is, we basically test it with a number of stakeholders, and it's approved by the Information Commissioner's Office and the National Data Guardian. So it gives that kind of badge of approval so that you can trust it and have that assurance that it's gone through that process. So coming back to why we're here, we thought it would be maybe helpful, and this is what we're going to seek your views on today, to look at producing some guidance around clinical audits and QI in this kind of format. So it could potentially give you that really practical advice, but also there's some advice for IG professionals and really engage you throughout this process. So I'm now going to hand over to Tamir, who's in my team, to take you through some questions, and we'll poll you now and just to hear your to seek your views today on this. So Tamir, are you happy that I hand over to you to run this bit of the session?
Yeah, that's fine. So hi, everyone. My name's Tamir. As Rachel mentioned, I'm in her team. So when we were thinking of how to do this poll, we went on a bit of a journey. There was lots of fun options out there where you can see graphs popping up live, but paywall issues and the fact that this was like a call where I wasn't the organizer meant that was a bit too risky of it all going pear-shaped. So we're going to return to, I think, everyone's friend, MS Forms. No doubt you will have filled out one of these before. So I'm going to post a link in the chat, which actually means you're all going to go to a different website, but just have my voice in the background. So I'll share my screen, but if you all just follow that link to the form. Now, after we've gone through the questions, I think I'm just going to go through the questions with everyone, but obviously you'll be doing your answers sort of in your own time and clicking submit at the end. When we get to the end, we want to talk a bit about the results. So there's 70 something people on this call. That talking about the results could go one of two ways. Either we get a really good response and there's 60 to 70 bits of data to look at for each of those, or only 3 people do the quiz or something and we end up with terrible data at the end. So please, if you've got the call in the background, as I know I tend to do sometimes, if you could just come and click on that link and do this survey with us, that would be really, really helpful. Because as Rachel said, the aim of this is to produce resources that will support this a bit more for all of you. So if you go on the form, question 1, are you clear about the information governance requirements for local clinical audit and local QI? So the emphasis here is on local clinical audit. So that's in your own organization, ID requirements. Are you clear? And the answer could be totally clear. You could be mostly clear, but with some questions. You could not really be clear, or this could not be relevant to your role. So that's the first question. Carry on going through them, but obviously you can feel free to do them in your own time. Go faster than me if you want. Question number 2. Are you clear about the information governance requirements when sharing data regionally? So the emphasis here is on regional sharing. So when requested by ICBs or for audit. And again, totally clear. You're mostly clear on ID requirements regionally, but questions come up. You're not really clear, or it's not relevant to your role. So question number 3. Here we're talking about information governance requirements for national clinical audits. So the same question you've had twice, but now it's about, you know, when it's national. the ID requirements around that. So again, totally clear. You're mostly clear, but questions do come up. You're not really clear, or it's not relevant to your role. So first three, just all about your own sort of knowledge, where you stand at the moment on information governance requirements. So now question 4, do you think some updated information governance guidance on clinical audits and quality improvement from NHS England / HQIP would be helpful? So yes, no, or maybe. I think we can dig a bit more into that, what that maybe is in a later question, or perhaps in the Q&A. Probably be useful for us. Question 5. HQIP previously published guidance called Information Governance in Local Quality Improvement. Which of the following is true? The guidance fully met your needs. The guidance partly meets your needs. You don't find the guidance useful. You worry it is out of date. You have not used the guidance, or you're not sure. Question 6. Where information governance questions arise in relation to clinical audits and quality improvement, what are they about? And for this one, you can go through and select a load of options if many of them are relevant to you. So when you have questions about ID requirements in relation to clinical audits, what are they about? Is it about who in the organisation has permission to access confidential information for audit purposes? It could be about who in the region, for example, the ICB, has permission to access confidential information for audit purposes. It could be around the national data opt-out. It could be around anonymizing the data for reporting purposes. It could be around when IG documentation needs to be completed around clinical audits, such as data protection impact assessments. Or it could be something else that you have burning questions about in relation to information governance or doubts. So if it's something that's not one of those that's on the list, if you could just type it out in chat, or obviously you can feel free to put your hand up after this and we can talk about it in the Q&A. That's fine too, if you don't want to type it in chat. So last question here, 7, hopefully it's not been too painful. Do you know who in your organisation to seek help from if you have an IG question? So you might know who this is, yes, and you can access the support you need. You may know who it is, who it technically should be, but you cannot always access the support you need. Or the answer could be no, you would have no idea who to consult about IG questions around clinical audits. So if you could then, once you've done all that, if you could submit your answers, I'm going to go over to the results tab now and find out how many people responded.
A live reveal.
Yes. I can see we've got a hand up. Do you want to, is it Carl, if you want to just come off mute, feel free.
Is that a hand up or is it an accidental hand up?
It was maybe a fake hand or an accidental hand.
Cool.
Yeah. Okay. All right. Yeah. Okay. Cool. First question.
Are you good? Are we ready?
Yeah. So we have 46 responses to the first question. So that's something to work with.
Great. That's a good.
Okay.
It's a good. Giving us a good thing. Okay. Great. So 11% is totally clear, which is amazing. So I'm not sure I would be. So that's good. But it looks like most are kind of like questions come up, mostly okay, but questions come up. So that gives us a good indication. 76%, quite a clear majority in that section. Okay, so we'll go through and see what kind of questions are coming up, I hope, as we go through this. So that's local clinical audit. So for it looks like, so there's for regional audit, you're less clear about the IG requirements. So before we had 76 for mostly, whereas it's shifted a bit to 59, so it's gone down. So it looks like regional audit, there's more questions than local. Okay, thanks, Tamir. National, somewhere in the middle. So mostly people are clear, but questions are coming up. But it looks like there's people are probably feeling that regional audit is where there's the most questions. Okay. Okay, that's good. It looks like definitely there's a really clear steer on that, because we really didn't want to produce guidance if you felt that it wasn't needed. So that's a really nice steer. So I guess we'll take that as we'll definitely provide some guidance. So we'll just look at where those questions are coming up so we can target at that where you most need the guidance. That's really helpful to see. Thank you. Okay, so that's telling us that actually quite a lot of people have not used the HQIP guidance. So I think with us working together with HQIP on the new guidance and using every channel possible to promote that guidance, that looks like it's a good opportunity to kind of refresh this, make sure it's targeting things you want, and actually really work on how we best promote this and make sure that you're all aware of it. So that's, again, really helpful to see. And again, that guidance partly meets needs 30% of those who've accessed it, saying it's partly. So we need to really look into where the gaps are in terms of that guidance. Great. So, so this is a bit of a, so the national data opt-out is obviously a quarter of respondents need more guidance on national data opt-outs. I think that's very clear. The rest look kind of split, don't they? Would you mind just going up again to me, just so I can see? They're pretty evenly split between the others. So it looks like in terms of what we've highlighted there, some of the key areas where people will have questions. I think after this, once we've gone through the rest of the results, it'd be really good to open up the chat and hear from people around any other areas or what specifically people are having questions on relation to that. So we won't answer them today. It's just so we can scope this out. But it looks like we are targeting there some of the issues that are coming up. And then the final ones. Okay, it's great. So it looks like where there's questions, you get mostly find that you've got the support you need, but there's still 11% can't access it when they need it, which is quite interesting and a fair proportion. Okay, that's been really, really helpful. So I think there's a really clear steer that we will work together on and have this as an area work together on for some guidance. Definitely regional audits is one that's creating some concerns, which is I'm not surprised about because it gets more complex. And would anyone like to come into either in the chat or take themselves off mute, put their hands up and give a bit more insight into some of the specific areas where you have questions? Just not so that we answer them today, just so we can kind of scope this guidance out a bit more. It'd be really great to kind of chat through that with you. Mir, would you mind just keeping an eye on the chat and the hands?
Yeah, that's fine. So I can see we got a hand there from Sue, and Rachel, you've put your own hand up, which I assume is an accident.
See, this is why I have you here to keep me under control. Do the technology for me. Sorry, yeah. So who? Sorry.
Sue, do you want to come off mute?
Oh, Sue, would you mind coming on and just giving a bit more information? That would be great. Nice to meet you.
Hi. Yeah, I mean, I've had some problems in my trust, and that's really been around. I mean, I think I felt quite confident about some of the IG requirements because I think the HQIP guidance has been really useful, but actually trying to convince some of the people in my trust. And maybe it hasn't been, the guidance hasn't been as clear, and maybe they haven't recognised HQIP as the high enough authority to agree with me. And really, that was around consent for being involved in projects. I had a lot of problems because my trust was insisting that people actively opted in to be included in national clinical audits and even sometimes local audits, rather than us just needing to take into account the national data opt-out. And yeah, so I had a lot of problems with that and had a lot of problems trying to find somebody somebody nationally who was willing to then come and, you know, help fight my corner in my trust. It was quite a challenge.
Is it the IG professionals that you are having the So I think maybe here, if we're producing the guidance for the IG professionals as well at the same time and cascading it via them, that should help you. And also with the badge of the ICO and the NDG, again, that hopefully that should help in terms of if that blocker.
That sounds great. Thank you.
Okay. Mir, I'll hand over to you to chair anyone else. Bring
I need to just see who was. Okay, so it was Sue first, and then it was Janet.
Janet.
Hi there. Sorry, my camera's not working this morning.
Morning.
My question is around advice for national audits. So when a patient has opted out and we run our check and we don't include them, but then the consultant speaks to the patient and they decide that they want to take part in the audit, what can we do then? Because I understand they still then, once we submit the data nationally, they're still opted out because they've signed the national thing. So that was all. If there's any way around that, and particularly the one I'm thinking of is the national arthritis audit.
Okay. So yeah, I think yeah.
I often want to know what they're opting out of, to be honest.
Yeah. So where someone's given their
Oh,
sorry, I don't mean to butt in. The line was just a bit funny.
Sorry. It's because you can't hear me. Sorry, don't worry.
Oh yeah. So where someone's given their sorry.
Go on.
Or where someone's given their consent to share, it should override that opt-out. So we can make that clear, but also we'll just check into what the actual process around that as well.
Yeah, that would be great. Thank you.
Thank you.
Can I hop in as well, Rachel, just to add into that, because I lead on the National Data Opt-out HQIP as well. So I think it's a really good point. I think the advantage of redoing this, because I'm also picking up on Carl's written comment here about why not we just repoint to the existing guidance. And I think there is something really, really strong about that dual badging, because I think what happens is that guidance exists, but trusts are nervous about NHS England and other requirements and therefore aren't sure they can follow the HQIP guidance. So I think the advantage of having that triple branded published in the National Information Governance Portal, which is the portal that is the rule book. So you can't argue with that there's a real advantage in that. I think also, Rachel, we can work together to access what's left of the what was the NHS Digital National Data Opt-out implementation team, because I think there is a gap between the conceptual idea that opted out patients can consent back in and actually what that looks like in practice and what evidence you need to be all right to do that. So we can probably access some guidance internally before we write this external guidance that will help with this.
Definitely. Okay, thank you for feeding in.
Next we have Diane.
Hi, Diane.
Oh, I couldn't find my mouse then. Hiya. So I just wanted to ask about the data protection impact assessments, because obviously the national audit teams that fund the national audits, they complete those, but do we have to do them on a local level as well?
So because I'm not an IG specialist, I won't answer that, but we can absolutely make sure that any guidance we produce is clear about what documentation you need to fill in. We also have just launched new standardized templates, including for the DPIA. So it may be that we could, as part of this, kind of partly fill in one and tailor one so that it can be used locally, so that everyone's not having to start from scratch. So we can have a look at that if they're needed.
Probably worth just hopping in, sorry, Rachel, again to say, to my knowledge, and again, don't quote me, but please don't all go start doing local DPIAs for national audit. We will look into it, but I do not believe that that is a requirement. As you say, it's done centrally. The data flows are scrutinised nationally. I don't understand how a local DPIA would add to that, because you don't have control over the confidential information you're being requested for. So please, that was just an example in one of the questions about the sorts of things people worry about, whether they should fill in or not. And there might need to be clarity, not a prompt that everyone's doing it wrong.
Oh no, don't start all doing
this. My IG team just requested for the national audits as well that we do local DPIAs. So if we can get that guidance, I just think the guidance that we've got at the moment with HQIP, I think it needs to be a bit more in layman's term, with a bit of a flow chart, so you can see exactly what you need to do for a local audit, a national audit, and a regional audit.
Yeah, okay, that's really helpful.
Thank you.
Great.
Okay, next is Carl.
Hi, well, one point and then a couple of tips really in terms of networking. First thing, I would phrase things as assurance and improvement, because again, some people think clinical audit have got all these governance things that we need to follow, and everybody else doesn't need to follow governance. So I think we just need to get the messaging out there that whatever improvement or assurance work you're doing, there is governance that we need to be following. So so that would be with the comms. Anything you do would be useful, please, and not just signalling out clinical audit as a process that needs particular IG. And then in terms of practically locally in your trust, make sure you've got a good working relationship with your head of privacy. For certain, we've built in IG questions in our project planners now, sort of thing, so that people know about if they're collecting patient identifiable data, then they need to do a DPIA assessment, and then that goes through to our head of privacy, etc. And also make sure that in your privacy notices that goes on your internet, that you say how you're using clinical audit information, because that helps you with a lot of the paperwork. Because if you put in your privacy notice that you're using clinical audit for improving patient care, then it cuts out having to do a lot of paperwork.
Great, thank you. Good tips, thanks.
Okay, next up we have a situation where the name is blurred, but I can hover over it and see that it is Jordan.
Hi, Jordan.
Yeah, hi. Mine was just a quick point, just to build upon what Sue said earlier. I've been in a situation where I've worked for two different trusts, and they seem to have had two different approaches when it comes to the clinical audit and the release of data, for using things like conferences to share with, regional groups and world colleges, that sort of thing. So I guess any sort of standardization or guidance that can be given to IG professionals, which would then filter down to us, would be of some use. It's kind of been one extreme to another. So in one organization, I was filling in Caldecott forms for every single thing that I did. And then in the other organization, it seems that one sort of fits all. However, I'm now filling in data flow questionnaires for every other thing that I do. So it's kind of been one extreme to another.
Yeah.
And I think if there was some standardization across local trusts and IG teams, then that would be great. Not to bash the IG professionals in my organization, obviously, they're just doing the job. But I think one organization, they've been easier to work with than another organization, and for various things it's been vice versa, and it just seems a bit sort of, well, in that trust, how come I don't need this, but in this trust I do need this, sort of thing.
Okay, that's great. A clear steer there for some standardization. So hopefully this guidance can help with that. Anything else, Tamir?
So yeah, there's no more hands. I'm just scanning the questions. So one point raised is maybe we need to raise awareness about existing guidance before developing more. So I don't know if we can look at getting that publicized more and see where we can go. But I think from what we've talked about, there might be some new areas that need to be covered nonetheless.
Yeah.
Data sharing / data access and joint audit between primary and secondary care seems to cause issues. So that might be something to note for the guidance.
That's that kind of regional, the regional side of things. Yeah, that's helpful to see.
Another person saying the main issue is role ambiguity in new leadership team. I'm assuming that might mean is it a local leadership team that we're talking about in that comment? Is it Beth? Is it? Do you want to come on and clarify?
Sorry, yes. It is essentially it's a local trust audit. I run the local audit for our department, and we've got a whole new leadership team. And the clinical governance lead that was my go-to person who used to do all these national things has now left, and it's not been picked up by the person who was doing it before. So I'm a little bit, I feel like I'm filling a gap here. And I'm certainly learning a lot, but I don't know the processes above my station, because it's not, and the person that stepped into the role above me doesn't have any concept of those processes either. So I'm cast adrift a little bit.
Thanks for clarifying. Yeah, so I suppose some clarity on responsibility, different positions. Sorry, Yvonne, did you want to come in?
Oh, sorry, I don't want to cut that one short. I was coming in with another question actually after. Was there anything else you wanted to say on that point, Tamir?
No, that's. I mean, I'm looking at some of the other ones. I think they're more back and forths after that point in the chat. So I think with that, I think we've probably covered the comments we've received.
Okay. I was just going to come back because I think if I remember from the results, there was a relatively high rate of questions around the national data opt-out.
Yeah.
And I just wanted to maybe dig in a little bit more because it's an enormous topic. So there is a lot of published guidance published by NHS Digital originally around national data opt-out. It'd be quite useful to hear from folk the sorts of specific implementation challenges they're experiencing in relation to what we're talking about here, so that we know which way to head with supporting on that question, maybe.
Anyone want to come in on that or drop anything in the chat?
We've got Zoe.
Zoe? Some insight into that question.
Sorry, I'm here.
Hi.
Hi. So just a few weeks ago, I had a query with regards to the National End of Life audit, wanting to know if they had data opt-out status or not, and I'm still waiting for a response. Nobody seems to be sure. So that's quite a specific one for me in terms of the registry. Is it up to date? Has it got everything on it that we need to be on it?
Yvonne, do you want to come in on that one, or should we take that one away?
So that's a question around whether there's exemption from national data opt-out for that audit, or a different question? Okay, so that's, we can take, certainly one thing we could take away as an action definitely is we could pop into maybe into the forum or something the link to the list of exemptions, which is published and kept up to date by NHS England, so that you know and